Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Well, good morning. I'm Jim Stallings. Kay Murray is on vacation for a few days, so she'll not be co-hosting the program today. In the studio is Cindy Jaworski. She's an exercise physiologist in Mon General's Cardiac Rehabilitation Department, and today we're going to be talking about exercise. Good morning.
Good morning.
Exercise. It's something that comes up just about every Health Talk program because getting exercise is really beneficial for a longer life, right?
Absolutely. It's essential for keeping everything in check. It can make you feel better. It can make you move better. It can even make you look better. But really, the reason why people should be exercising is so that way they can enjoy their lives. It helps them keep control of their health, something you have control over for sure.
Well, we know that enough exercise is good for us physically, and we can talk about that a little bit later on. But what about psychologically? What does exercise do for us psychologically speaking?
Psychologically, exercise has been shown to decrease the occurrence of depression. It helps reduce anxiety and panic attacks, which seem really prevalent lately. What happens a lot of times when you exercise is you're releasing the stress hormones. In effect, it makes you a little bit more immune to the same hormones that are released when you're having a panic or anxiety attack. So you condition your body to handle those hormones. So exercise is really good for that. Not only for handling depression and anxiety, it's also good to keep you with a good mental status. Just as little as 15 minutes of exercise about 3 times a week has been shown to maintain brain function. And it's also been shown that it can help reduce the chance of getting Alzheimer's and dementia.
A lot of times when we hear the word exercise or think of exercise, we take our mind to a treadmill or someplace where we're sweating, where we're really working out. But I think that exercise encompasses a lot of different things. Is it most simply defined as movement in some way? Yeah,
exercise can incorporate many different things. We kind of differentiate between physical activity, which is the activity that you, just any type of body movement. Exercise is more intentional, setting aside time to do things that will increase your strength, increase your endurance or flexibility, help with your balance. Those are intentional things. And some people are very active even without setting aside time for exercise. What can happen, though, is your body gets used to what it's always done. So if you want to make yourself healthier through exercise, you really need to shake up your routine a little bit. Add a little bit more walking, add a little faster pace, maybe add some weightlifting.
So we may think to ourselves, well, on the way to work, I'll stop and have a couple of donuts, and it usually may be a 5-minute walk from the car to the office. That's enough exercise for me. But that's talking about getting into the same routine every day, and you're talking about you need to change that up a little bit.
Right. I just talked to a lady this morning at the hospital because part of my job is to do education with the patients. And she was saying, I'm very active. I do all my housework. And I've been doing that for years. And so I had to remind her that probably it's not increasing her heart rate. In order to make your body get stronger, you have to expect a little bit more out of it, and then it adapts. So I mentioned to her that maybe what she needs to do instead of going up the stairs once is to make an extra trip up the stairs and maybe walk across her house a few more times. When she's doing her laundry, maybe she should lift the basket up and, carry it instead of moving it with her foot. Different little things like that can add exercise to your day.
Is that considered cardio exercise?
Yeah, the difference. Cardio is exercise that's performed continuously for several minutes, and it's going to increase your endurance and stamina. It's things like walking and bicycling. It can even be when you're sitting down in a chair, moving your legs up and down, moving your arms back and forth. But it's going to increase your heart rate. And then we also have resistance or weightlifting, which is going to increase your muscle strength and your bone strength. And that's where you're expecting your body to move a weight over a little distance that it doesn't normally do.
It sounds as though, for my wife and I, who try to walk a mile every night, that we should perhaps step it up a little bit, maybe make our body work a little bit harder.
Yes. Now, what we try to tell our patients is that you want to do something that seems somewhat hard, not to the point where you can't talk while you're doing it, but you do want it to elevate your heart rate. So it needs to be a little bit more than a casual stroll, a little bit of a brisk walk. You can still talk, and that's a good safety precaution.
Well, we talked about cardio. Another type of exercise is flexibility training. Mm-hmm. Is that something different than cardio?
Yes. Flexibility is going to help maintain the function of your joints. And that's where you just try to increase your range of motion by doing some stretching. Your joints have fluid inside of those, and by stretching those, that will help keep that fluid so that it helps your joints move more smoothly. So many people get joint problems. And if you don't keep stretching, pretty soon you're not going to be able to move that joint. People get frozen shoulders pretty often, and what you have to do is just keep stretching that slightly. You don't want to do it to the point where it hurts, so, it's just slightly uncomfortable.
Is that where yoga comes in? Is that kind of training like that?
Yes. Yoga is a very good exercise for keeping your joints flexible. It also helps with balance, which is another type of exercise that's not really talked about as much. As we get older, we lose some of our capacities that help us keep our balance, like our vision gets a little bit not as good as it should be. Some things that occur in the inner ear can help us be a little bit more off balance. Even sensors on the bottoms of our feet kind of get where they don't function as well. All those things help keep us in balance. By doing balance exercises like we do sometimes in yoga, it can help compensate for that.
Does yoga also help you ease your mind? It seems to me that a lot of yoga is mental and getting yourself into the right place. Or am I on the right track there?
Yes. I'm not a yoga expert by any means, but I have been into some classes, and it does help you rise beyond some of the stresses that just accumulate with going through your day. So exercise, whether it's yoga or running or doing something that's moving your body, actually does help you move beyond those stressors of normal life.
It's probably unlikely that you'll become so flexible you'll be able to kiss your own shin or anything like that. It's probably going overboard a little bit, I would imagine. What about resistance training? What is that?
Well, resistance training is the moving of a weight that's a little bit more than what your body is accustomed to doing, moving it over a small distance. And what that's going to do, it's going to strengthen your muscles, which in turn is going to help support your joints and keep you able to move the way that you need to. It also helps strengthen your bones, and that's really important in order to combat osteoporosis. So when you do some weightlifting, it in essence bends your bones slightly. This is very simplified, and that in turn causes some more cells to be laid down to make your bones stronger. That's very simplified.
So how beneficial is it for us in the long run to exercise 15 minutes at a time 3 times a week or every other day?
Well, what we recommend is 30 minutes almost every day of the week, at least 5 days of the week. We don't expect people that have not been exercising to do that right off the bat. If you haven't been doing any type of exercise, doing 5 minutes a day is going to be beneficial. It's a matter of asking your body to do a little bit more than what it's expected so that your body will adapt and become stronger, whether that's your muscles, your cardiovascular health, your flexibility. All those things can improve just by doing as little as 5 minutes extra than what you've been doing. Of course, if you're used to have a really active job, you probably do need to do a little bit more than somebody who is pretty sedentary.
And maybe we could start with, if we're going up and down the stairs several times today, should we pick up the pace going up the stairs and down a little bit just to get started?
Well, I'd say that might be a little bit too vigorous if you haven't been doing that. I would recommend if a person hasn't been doing very much activity to walk on level ground and just try to get to a point where they just can feel their heart beating a little bit more. Going up and down stairs is excellent. You can incorporate that. People that work in offices, they sometimes have a hard time getting in exercise, and they definitely, should start trying to get to that point where they feel comfortable walking up and down the steps.
On an evening like last night or evenings like tonight, it's very comfortable walking outside. Is it usual to break out in a little bit of a sweat, maybe get a little sweat on your back and coming on your forehead? Is that normal?
Some people sweat a lot and some people don't. Sweating is a way of our body has to cool itself, and a lot of people do find that they sweat. If you feel like you're getting out of breath or you feel like you're to the point that you can't talk, a person should lay off, kind of throttle back a little bit while they're exercising, and regardless of whether they're sweating or not.
So how do we know for sure we're burning the calories as we're walking?
Well, that's sort of a trust sort of thing. You need to just know that if you're exercising, doing a little bit more than what you have previously been doing, then you will be burning some calories. That really, I hate to have that as the focus, because it's so hard to attain some of the goals that we set for ourselves. And so that's why I really think it's important just to start doing something every day, just kind of have this conscious effort that you're going to incorporate some more exercise.
Yeah, you're convincing me, because we've been walking a mile a day for about 2 to 3 months now. I guess it's time to start stepping it up to 1.5 miles and then 2 miles, right?
Yes. My husband and I, we like to walk a lot, but we also like to walk and talk. And so sometimes we'll be walking and we're getting at a snail's pace, so we have to remind ourselves, okay, if we're going to really do this for exercise tonight, then we got to step it up a bit.
You're listening to Health Talk on WHAR. It's brought to you by Mon General. Cindy Jaworski is our guest, an exercise physiologist in Mon General's Cardiac Rehabilitation Department. We'll be back. Oh, by the way, if you have any questions and want to join in, 304-296-0041. We will be back right after this.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
Back with Cindy Jaworski here on Health Talk on WHAR, brought to you by Mon General Hospital. And I know you're cautious about people who are starting to exercise for the first time in a long time, because people just can't jump into it right away based on their current health condition, right?
Right, yes. You really should get permission from your physician, a good checkup, and ask them about exercise. If there's any kind of precautions that you should be taking, that's very important. Of course, I work with cardiovascular patients, people who have had problems in that area, and we start them out very slowly. A lot of these people are people that haven't exercised for a long time, and so they're easy to convince to take it easy while they're getting back into some exercise. Unfortunately, we have a lot younger people who have ended up with some heart attacks or maybe open heart surgery, or at least getting some arteries opened up. And they're harder to convince that they need to take things gradual. And that's the gist of it. To get the benefit of exercise, you don't have to be extremely vigorous. You just need to go about it gradually, make small steps, and get back into your normal routine gradually after you've had some kind of problem. But working with a physician is very important. Day
2 of our exercise program, we're sometimes sore because we haven't used those muscles.
Right.
Is that normal, or should we try to avoid that by taking it so easy on the first day we're not sore on the second day?
We try not to scare away patients by having them exercise too vigorously the first day. But it is, if you haven't used a muscle for a while, then yes, you could very likely get sore the next day. It just shows up later. A lot of times you can help that to improve by doing some stretching after the exercise session, and even the next day do some stretching. But we don't want you to be so sore that we don't want to damage anything. They used to have that saying, no pain, no gain. That's absolutely not true. So just going about things at a gradual pace. If you are have a little bit of soreness, go ahead and stretch and try to get rid of that. But just know that that's part of the process.
Well, I've probably, I guess, dropped about 17 pounds, at least when last time I visited my doctor. I think it's mostly from the walking we're doing, but also trying to control the portions a little bit. But I noticed, for instance, the night before last felt great. I mean, I walked the mile, but last night my hip joints were sore. And I thought, well, what did I do differently? Why was I not sore last night? And tonight my hip joints are sore. And I mentioned this to you during the break, and you came up with a suggestion right away. Right.
When you feel some soreness like that, sometimes it's because we have tight muscles. When you're walking, some muscles are working harder than others. And by doing some stretching, that can help compensate for some of that soreness. Now, if you find out that over a few days you're still having that soreness, then you might be having an overuse injury. And if that's the case, then you really should lay off of it a little bit, maybe try to find something that's not aggravating that same area.
Well, overuse injury, coaches along the way used to say, walk it off.
Yes. And there are some injuries that you can just do what you were doing, but just do it at a less vigorous pace. But a lot of times we need to let certain areas rest.
I think the hardest part with a program is day one. I mean, you tell yourself forever, I'm going to start exercising, I'm going to start exercising. And I think lacing up the shoes and stepping out the door or doing whatever you're doing to start is the toughest part. Once you get past day one, maybe it's harder again if you're sore the next day. But what can we do if we are just reluctant or have trouble getting started or lack the motivation to get started?
Well, some people, maybe their first step is just that they need to start picking up fitness magazines and kind of glancing at things and thinking, well, this is something that I think I want to do. I'll read a little bit more about it. That sometimes helps people get past that point where they're having trouble starting. With other people, having a friend that's also interested in getting more exercise is a good thing to do. And actually having a buddy that you work out with is a good idea for safety too. But a lot of times having somebody that's going to encourage you, getting into an exercise class is a really good idea. If you're not sure if you want to do an exercise class, then go in and observe the class. Just because you step in the door doesn't mean that you have to step right into the exercising at that time. So just go in and check and see if that's maybe something that you like to do. Incorporating exercise into your everyday routine, maybe just trying something little every day is helpful.
You're listening to Health Talk on WAJR. We'll take our final break and wrap it up right after this.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Cindy Jaworski is our guest. Okay, about 60 seconds left to inspire us. Can you inspire us to exercise in 60 seconds?
Well, I will try. I would say that exercise is essential if you're wanting to enjoy your life. It'll keep you doing the things that you want to do. And with myself, I try to be very honest with myself. If I find out that I'm starting to not fit into some of the clothes that I used to wear, if I'm feeling some soreness, some stiffness, I go ahead and take steps to make sure that I combat that. I'm going to grow older for sure, but what I really want to do is I want to grow as old as I can and still remain young. And so exercise will help me do that, and it will help everybody else too, just by taking little steps.
Thank you, Cindy.
You're welcome.
And very good guest this morning, Cindy Jaworski, our guest. And again, she is in Mon General's Cardiac Rehabilitation Department. She's an exercise physiologist. Stay tuned for Morgantown AM, the talk of the town, coming up after the news on 1440 WAJR.